Welcome to Startup Health Now with another COVID-19 health innovation update. I'm Logan Plaster, editor of Startup Health magazine, and I'm joined today by Sara Yelpaala, Chief Experience Officer at Access Mobile. Sara, thanks for joining me.
Yeah, thanks for having me. Excited to be here.
I'm very excited to hear what Access Mobile is working on. Yours is one of these startups where the product is baked right into the title. You know, we're at a moment where access is so important, getting healthcare to the people who need it most in a timely manner, and doing so over mobile devices. So I feel like Access Mobile, you are just you were designed to be in this moment right now. So I'm excited to hear what you're working on. So why don't you break down the Access Mobile product for me and tell me kind of where you're at in the rollout?
Perfect. Yeah. As you said, it's always been our moonshot and mission to improve health access and information through the mobile channel. So we offer a mobile solution to communicate with precision and with cultural competency. And so, yeah, we hadn't messaged directly about COVID until this last month, but our product is designed to send out messages, targeted, direct messages to lots of individuals. And we work both in the US and in South Africa.
Did you start? Did you start in South Africa and then roll out in the US, or other way around?
No, we actually started in East Africa and worked there and kind of built our product, and then started working in the US and South Africa in the last 3 years. And that's where we've really seen a lot of expansion and a lot of growth. And so right now, you know, with COVID, obviously it's a global pandemic. And so we're seeing obviously the same needs around the world. So what's happening in the US is a few weeks ahead of Africa. South Africa is kind of the start in Africa, given the tourism. So they're kind of driving the numbers there. But then the rest of Africa is anticipated to be hard hit in the coming weeks, but it does time and kind of getting things prepared and ready. So yeah,
Okay.
we have been working we had the platform and the solution in place. And so since early March, we've really been working on getting a repository of COVID-19 messages based on organizational, local, national resources, getting those up. We work really hard to make all communication mobile friendly. So that means getting it into very short, digestible nuggets of information, making it very low literacy. And then we have a behavioral scientist on the team that also works to make sure that the right behavioral nudge is in there and it's driving as much change as possible. And then obviously working globally, we do a lot of translation.
Okay. So talk me through a typical patient encounter, typical type of patient who would use the platform, and what types of messages are they getting?
Yeah. So we work with health providers and health plans, as well as like large organizations. We have scaled to doing lots of messages every week. So patients are receiving about 3 messages a week. Before, when they were receiving kind of general health information targeted to them, it was more like twice a month. And now they're receiving, dozen plus every month. When we started in early March, obviously the focus was really on COVID-19 information. When it was new, there was a lot of misinformation. People didn't know. Your provider and your health plan is largely a source of truth. And people were looking to them for the right information. And so getting direct information from these sources was really important. So early on, it was, all the education around prevention and symptoms and where to go, as well as kind of the organizational changes, what's happening to my appointment or my prescriptions. And then more recently, it's been more about local information. Where are the food resources? Are there any programs for education, and how can I help? And then also kind of that shift too, as we're kind of getting further along into coping. So wearing a mask, doing errands, but also mental health and domestic violence and what to do with those, where to turn to.
Has Access Mobile always been a push platform where you're sending out educational information versus a two-way sort of chat situation?
Yeah, it's both. It starts with the provider and plan, but there is direct two-way. I think another interesting use case during COVID-19 has been on the direct two-way platform. As you know, uh, people that have been exposed to COVID-19 are kind of under investigation, and this happens also in the healthcare setting. So you have staff who are considered people under investigation that are followed for 14 days by the health system to see how their symptoms develop. And so some of the systems we were working with were doing manual calls to everybody exposed to check on their symptoms on a daily basis, their fever, the respiratory symptoms, and if they'd been tested. And we were able to move that all into automated two-way direct messaging. So checking in during shift change daily about these, and then following up as needed based on kind of the symptoms or the testing that was coming up or their questions.
Got it. Why is an SMS-based platform important in a sort of global health strategy?
Yeah, we look a lot at health equity. And for us, it's a mobile first world, and healthcare is not generally mobile first. I know COVID-19's given it a nice push into the digital world. But for us, the mobile phone is always first, and SMS is reachable to all people, whether you have a smartphone or not. When you look at kind of different breakdowns and lower socioeconomic groups and Blacks and Hispanics, there tends to be about, I think I was looking at Pew Research, about a quarter are what they call smartphone only. So they do not have broadband access on a computer.
Got it.
So pushing to the phone is really important. And then you are also, in a global context, so also working in East and South Africa, it's important to not rely on any internet access. And so how do you kind of get that information in the hands of anyone? So it's really, for us, we are multi-channel, but SMS tends to be the preferred channel of most of the patients we work with. And it tends to kind of level that digital divide that, you're starting to see kind of more talk about, given kind of the push to more digital recently with COVID. SMS kind of helps reach everyone.
Yeah, it also forces you to, I would imagine, it forces you to really distill your language and be just incredibly crystal clear. So in your mind, what role does kind of communication theory and strategy play into this?
Yeah, I mean, we largely do see ourselves as kind of, Facebook and all these other people that have mastered marketing in kind of small nuggets and how to get information and how to really personalize the messaging, and healthcare is not there. And there's, regulations and things that stand in the way of doing some of that. But for us, we really have to be crystal clear. In South Africa, we also do what's called USSD, slightly different from SMS. But you're given 160 characters, and there's only so much you can write. So you're writing the shortest words and kind of getting that powerful message out in a as crystal clear way as you can.
What are your strategies for that? I mean, how do you accomplish it?
Yeah, luckily we have a really good team here. So we work together. We have a group of clinical doctors that help with the base information, but then it really goes through a lot of rounds to make sure that what's called the FK score, so the literacy score, is very low. We edit it as short as possible, and then our behavioral scientists really look at it to make sure that it's framed in the best way possible to nudge behavior. And then obviously we run tests. So when possible, we'll run multiple versions of a message and see which one's performing better, and then adjust accordingly.
Is that sensitivity to the messaging and FK score, is that something that makes Access Mobile unique in the market, or is that common in the market?
Some of it's common. I think trying to keep it short is common, but I think we do a lot more on the behavioral science. And I think, one of the things that really does make us different, I think people work hard on being multicultural, and we not only have the team that's multicultural, but we've worked cross-culturally. Okay. So not only are we implementing across groups here in the US, but we're working across the globe. And so we get real-time feedback, on these messages all over the world, and that can help us zero in much, much quicker.
Can you give me an example, a story about that cross-cultural collaboration, kind of how it changed what you're working on?
Yeah. I think, in South Africa, we're working on a project reaching up to 1 million people living with HIV. And so that number of messages that we're sending through the system, we're able to layer on what we call behavioral frames. So looking at social gain or, loss framing. So if you phrase it like you might lose something versus gain framing. Okay. And we're testing a whole bunch of messages that are going out to so many people, where in the US context, we might have, message going to 10,000 people. Gotcha. And so we can apply that same message and know what works there, even though it's different and it's localized and we need to test it here. We have some really good insights into the certain frames that'll work.
How much crossover are there in those insights?
There's quite a bit. So yeah, I think the behavioral frames and even the base messages and the way that we write, the clinical message. So really what we found is that the platform and the expertise, and then the learnings, those really translate. There's a localization to healthcare, as you know, and so it's important to make sure that there's nuggets in there, whether it's pointing people to the right resources or where to go, that those are truly localized, as well as, translation. But a lot of it, I would say, 70% pretty much translates across our clients.
Got it. So you're one of the companies in the startup health portfolio that's working outside the United States. You are working actively in South Africa. What are the trends you're seeing regarding COVID-19 specifically in South Africa that somebody in the States might be unaware of?
Yeah, they're kind of leading a lot of efforts there. They're moving pretty rapidly. So they had a lot of misinformation early, especially from social media and online. So they're putting out a lot of really big and good efforts. Symptom checkers, they're trying to institute regular text messages through their telecoms. They're also, working on contact tracing methods and things that will be kind of allowed and permitted for the context of COVID and a little beyond. So they are moving really fast. I think as you look at other countries in sub-Saharan Africa, the pandemic has yet to kind of hit those numbers. And I think there's a really varied response to what's happening, and governments' kind of actions have varied to a large extent. So It'll be a wait and see, but what's known is that there's not a lot of ventilators there. Yeah. There's not a lot of, clean water. So a lot of the things that you're looking at in the US in terms of our response might not translate one-to-one in that context.
Interesting. And generally from your partners on the ground there, what's their, general feeling about their preparedness?
Yeah, I think people are, if I'm being generous, that it might not be as bad. I do think that there are some protective elements, and that the population tends to skew to a younger age cohort there. I think people the health systems are blessed with a few weeks to get some plans in place, and are working hard to kind of create. And I think also, given some other pandemics, whether it's Ebola, or even the HIV crisis, and the infrastructure that they have in place from those will greatly help some of the pandemic moving forward.
That's good to hear. As a final question, you mentioned earlier that the pandemic is giving digital health a kind of a kick in the rear, yeah. and putting it front and center. How do you see post-COVID, the post-pandemic world, looking different for Access Mobile? How is this going to change, if at all, kind of your company, what you're offering, and its adoption?
Yeah, I think, for all of digital health, it's kind of put into focus the importance of all these digital systems. And we're no different. I think the mobile channel has become more clearly in focus for health systems, and the need to engage, one of our early slogans was, reaching patients when they're out of the facility. And I think in COVID, there's no better case, because, even the patients that you need to see can't come in. And
That's
so
right.
I think the need for the mobile channel is going to be clear. And I think for us, especially working on health equity issues, and with that in focus, I think that, I think that our work will only continue, but this has really been a catalyst for kind of what we do, and helping kind of see the importance of what we do.
Awesome. All right, Sara, thank you so much for taking the time to talk with me. I know you're busy, and I just appreciate all the work that you're doing there at Access Mobile.
Yeah, thank you guys.